Today, Dr. Erik Peper joins us to tell us about a very specific kind of feedback therapy that's been shown to help people with gas and bloating. So Erik Peper is the professor of holistic health of San Francisco State University, the president of the Biofeedback Federation of Europe, and he also maintains a private practice. I'm so excited to be talking with you today, Erik. Thank you for being here.
It's such a pleasure to be here and to share some of these concepts, how we came across this. And really, to be honest, they came almost accidentally.
Yes.
And it's because we work with students, and students all have to do a self-healing project. And since we're in the program of holistic health, the key is what can you do for yourself to mobilize your, support your own self-healing. And as a student, you're really different than as a patient. Because as a patient, you say to yourself, I have SIBO, I have, or you almost say, I am SIBO, I am the irritable bowel syndrome, I have migraines, whatever it may be. And it's like all of me has the sickness.
Yes,
if you're a student, you are a student who happens to have this disorder. And so if you drew yourself on a circular diagram, for example, in a circle, you could say, what part of you is your illness? And it's interesting for the students, most of the part is being a student, and a small part of them is the illness. On the other hand, when you often go to a healthcare professional where you are labeled almost you're the SIBO patient or the irritable bowel patient, then all of you almost is the patient, is the person. And so it's a different perspective. Out of this, you know, since the focus is what can you do, we have done this over the last 40 years or so in different ways. And one of the major things that came across purely accidentally was that, you know, that one of the students had irritable bowel, and then she was in the hospital, she was in extreme pain, couldn't, you know, nothing seemed to work. And then she happened to open up a book on yoga. I wish I was smart enough to have told her that. I wasn't at that moment. And in there, they talked about diaphragmatic breathing, belly breathing, not just that your stomach goes out forward, but also sideways and the pelvic floor goes down. And since she was just lying there in pain, she decided to do this. And after she really practiced that for about a half an hour, she noticed her discomfort start to decrease. That was the first time for her. Then she really practiced that. And then over time, in a fairly short time, in fact, she has become totally symptom-free. We have lovely follow-up on her. And that was the kind of official kind of beginning as a way of doing. Before that, we've had many other cases. So let me go back in history.
Yes, please.
You know, there's a disease called neurasthenia. Neurasthenia, what is that? That was an illness given to women at the turn of the century of about 1900. And these were women who had, you know, anxiety, they had abdominal pain, they had irregular periods, they had horrible, almost like you could say dysmenorrhea, they have massive gastrointestinal disorders. They would often faint when they would walk up the stairs. And in fact, in San Francisco, the first room on top of the stairs in the old Victorian buildings is called the fainting room.
Oh my goodness.
Now, why is this? And now think back of the 19th century. I already can see you do it. The women want to have a very slim waist. They wore these corsets really tight. And so they were massively constricted. And just do it yourself right now. Put your hands on your waist, really squeeze it tight, then tighten your belt at the same time. And notice what happens. You're freezing almost off. You're constricting the lower abdomen. And you're only breathing in your chest slightly. So you're, you go, makes it, or you breathe almost, I would call mouse-like, almost no movement at all, because you're almost frozen in discomfort.
The shallow breathing.
And what was the solution? The solution in those cases for most of these women was not more medication, not more surgeries. It was simply teaching them to wear different clothing by letting their abdomen expand. And if you think of healthy breathing, then think of a baby. When you look at a baby, it has its big Buddha belly. It moves in and out as it breathes. The chest is almost quiet. The neck and shoulders don't show much movement or tightness. It is no different in a way as my dog lying on its side and the stomach goes in and out. And how many of us, and especially people who have GI distress, breathe that way? Almost none. And so for the many years,
clenching and protecting, right?
Yes. Yeah. And now you see and kind of what I'll call an evolutionary trap almost, or an evolutionary response. We give a normal response when the world is dangerous. We freeze, we get sympathetically activated. But when we get sympathetically activated or give this alarm reaction, danger, and danger can be the symbol of pain, something is going wrong. It can be something in my past that makes no difference what or around me. This danger, it means the blood flow goes away from the abdomen into the deep muscles. My peristalsis slows down. And there is nothing wrong with that. That's great if there's a saber-toothed tiger there, and then I run away. Right. And when I run away, I complete this alarm reaction. And then I can go to a place of safety when I'm totally safe and I can regenerate. The trouble is for many of us today, we don't do the movement to complete the alarm reaction. So we stay activated and we forget that our brain and body are the same. So when we feel sensations in our body, our brain reacts and interprets that. Then we amplify that. Then we start looking for it. And then this is a cycle that keeps going. I am not saying that there's not something that could be really wrong there. I'm only asking, is there anything you can do yourself?
To help calm symptoms, absolutely. And I'd say, you know, IBS has one layer, but also with SIBO and people having to worry if they're going to make it to a bathroom, or worry, is that bite of food going to hurt me? I'd rather go without eating because it hurts to eat. I'd rather see 30 pounds come off because I'm so restricted with my diet because it hurts to eat. And the postural change with that, like there's the enjoyment of food is gone at that point. The environment feels extremely dangerous. There's so much fear that comes up with that. And now the whole clenching and protecting that happens. And I think it's interesting that when we go and lay down, if we're hurting and we go and lay down, we like curl in around our stomach. And people carry that with them when they walk around. They carry that with them as like this, they're protecting. And it's true. I mean, if you injured your arm, you would hold it, you would protect it. It's no different than that with the belly and the posture, and yet that clenching. And to add, women wear tight clothes, and we're already feeling distended if we're in that kind of state. And the idea that we're just going to let it loose feels counterintuitive, right?
Yeah. So let me put a few things for people what they can do and why. Because I think this gets even more amplified because when I do feel discomfort and it's not easily solvable, besides, so then you have all the anxiety, what can, blah, 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 blah. And then I sit at my computer and then I bend forward because I need to read the screen, or I look at my laptop and I look down again and I collapse. I'm continually in this kind of letter C position. And now think just of your trunk. When you think of your trunk, here's my ribs, this is my pubis. And now when I go into the letter C, notice the distance between my two hands decrease. That means there's less space here, really. There's more compressive forces on it. It doesn't really compress because it's liquid. But it means the diaphragm can go up and down. And it's the position by which, without knowing, I amplify that kind of stress, the defensive stress response. Just think for a moment out of the box in that sense. How do people feel when they are defeated, depressed, hopeless? You take their body posture on, you collapse. However, when you feel optimistic, the world is looking up. You literally expand and go upward. But now think what happened. And that is very important to think about. Because in our research, what we have shown, if you put yourself in this body position just like this, that's all you have to do. And now you evoke hopeless, helpless memories on command. Just do that. I'm going to do this. I'll give the instructions and you can do it by yourself at a longer time period. So you collapse, you slouch, just like you often do looking at the cell phone, or when you have pain. Now you evoke hopeless, helpless, powerless memories for about 30 seconds. Then don't shift your position. Then you evoke only optimistic, empowering memories for 30 seconds. And then you shift position. You look up, you make yourself tall, And now you think of only hopeless, helpless, powerless, defeated memories for 30 seconds. And then after 30 seconds, still looking up, empowering positive memories. What is so important, interesting in our findings on multiple levels, we have done this. When you are slouched, it's much easier. Almost everybody would say, I have much easier access to the hopeless, helpless, powerless, defeated memories. And when I'm trying to think of positive memories in this position, it's just harder. And in fact, in our studies, looking at the electrical activity of the brain, we demonstrate the brain has to literally work harder to try to, in this collapsed position, evoke positive memories. On the other hand,
oh my gosh,
when you are sitting up, looking up, and you can think of all the the world is looking up, like I said, right? Standing tall.
Right.
In the up position, it's slightly easier to think of optimistic, empowering memories. And when you think of the hopeless memories and defeated memories, as if you're a little more distant.
Yeah.
And it means you can think more abstractly. And when we apply that to performance with students doing math, for example, you do mental math, it's really stereotypic threat probably, but doing mental math, then when they collapse, slouch, they do worse. It's harder to do the mental math than just sitting up. It's as simple as that. And notice now that our body position, when we have pain, we collapse. When we start searching at the computer, we freeze, we put our head forward, we look at the screen, and we collapse more. And we are totally unaware of this. So let me explain maybe how you can breathe lower and slower and why that is important, if that's useful.
Please.
One, why do we tend to breathe more in our chest? We already alluded to one, that I give a startle, fear response. That can also be because I'm very emotionally sensitive. Someone else says something, I can feel their emotions already, and I react, and I did this as a tiny kid. And that's the pattern I've learned, conditioned. That's one. Two, as we alluded to also, clothing is important. Three, I've learned not to breathe in my stomach because I've had abdominal insults. Meaning surgery, whether that's I've had an, whatever abdominal surgery I had, or in whatever insults. That means if I have surgery, then when I move the abdominal wall, it hurts. And without knowing, I freeze, I hold it in place, and then I don't unlearn it. Now, why is this also important for this, if you think about it? We make an error about breathing. Traditionally, we think breathing occurs in our lungs. It does. That's not an error. In the alveoli. But what we forget is that really we need to have, breathing has more functions than that. It acts as the pump to encourage more blood circulation and lymph circulation in our abdomen. So if you think again of the baby, when the baby is inhaling, this whole abdominal area, like a big balloon, expands in 360 degrees and even downward. That's also true for humans, for adults. We're all humans anyway. It expands. And during the expansion, you could say the pressure is somewhat reduced. At that moment, the venous blood can fill the veins, it can fill the lymph vessels. And then as I exhale in the vertical position, I'm applying more pressure that squeezes these veins. And so I'm encouraging circulation. And that occurs because the diaphragm can move up and down. So when I inhale, I let my abdomen widen, totally counterintuitive, because it's the automatic impulse when we have pain in our abdomen is to do the inverse, to curl up, to be protective, which is great if there's a tiger there. I would recommend this. If you are attacked by a grizzly bear, curl up, don't do anything.
Absolutely.
Just act. And then if you're lucky, the grizzly bear will get bored and run away, just like the mouse would do if a cat is there.
Right.
However, it doesn't help regeneration. To regenerate, to heal, you want to feel safe, and we feel safe. And you can simulate this by putting music on, whatever. And then what you want to do is you want to let that area of your abdomen expand upon the inhalation and come back during the exhalation. And sometimes you can do that by making a little sound. If you do, you can go, you can hum, for example, or an easy way to feel that way, you can feel the transverse and oblique muscles in your abdomen. which are on the side, not the 8-pack up front that just tightens you down,
right,
but the ones that bring the abdomen in. So when you're exhaling, you may want to go psss. You can feel your lower abdomen tighten, and you can even feel your anus tightening a little bit if you did that, almost like doing a Kegel exercise on the exhalation. Psss. And then when you inhale, you almost feel like the whole area opens up like a big balloon, or like an umbrella just opening up, almost like your kidneys are expanding outward, and let the air just flow in. And then you want to breathe, not through your mouth, through your nose. Your nose allows the air to slow down, to filter, to warm, to moisturize. And even ideally, when you exhale, you do the same thing. So when your breathing slows down, so you inhale, you exhale, you want to breathe approximately, when you're regenerating, about 6 breaths a minute.
Yeah.
Plus or minus. So you inhale maybe to the count of 3 or 4. 1, 2, 3, 4. Inhale, almost stop. There's no hard stops. It's a trailing off, almost a pausing. And then you let yourself exhale again, let the air drift out for the count of 6 or so, almost pause. And then when a need occurs, you inhale again.
Yeah.
And we breathe and we feel safe that way. And when you practice that, you're bringing balance back to the sympathetic, parasympathetic system.
Yeah. What comes up for me as you're explaining all of that, especially with the population that I work with, is that, I mean, some surgery might have occurred for some people, and some of them also have IBS symptoms or some gas pains, but also even bowel movements are hurt. They might be in the bathroom 4 times throughout the morning and kind of clenching in a certain area, and they're used to clenching on a certain side. So it's like just a complete postural change. And then a lot of people, I think, work on computers at this point, depending on, whatever various jobs we have. And if you're working from home, you're probably working on a computer. But then somebody who might have a chronic illness are also trying to do a lot of research and figure things out. And so they're on their computer twofold compared to what the average person is. And then we're all watching the political race. So I think there's in a more of a normal world, there's a load on people in terms of that posture. And as you're speaking to, oh my gosh, I'm thinking about everybody walking around with their cell phones like this, right? I'm sure you're pointing it out as you're walking down the street, probably trying not to look. But I see that, but for my group and just for everyone I work with, I see that so often. So I recommend a lot of times to get a half bolster and put it in the back of your chair to pop your sternum up a little bit. I have people try to really pay attention if their shoulders are moving when they're breathing. I have them put a green sticker somewhere in their office, and every time they see it, they have to take a diaphragmatic breath. That one's fun, especially if they put it on their phone.
I think you're totally, so there, if you think about it, there are a couple of phases of learning. One is just learning diaphragmatic breathing or that abdominal breathing, and probably an easy way to do, which is different in the horizontal versus the vertical position.
Yes.
And on the horizontal position, when you're lying down, you'll be lying down with your legs slightly apart, really relaxed, and then put a 5-pound weight on your stomach, on your lower abdomen, like a bag of rice or a nice hot pack that often feels safe, especially if you have dysmenorrhea, menstrual cramps. Yeah. Really great. And then when you inhale, you let that weight go up. And then when you exhale, you don't have to do anything.
Yeah.
Because the weight pushes that. That is in the horizontal position. You want to practice that, breathing about 6 times a minute approximately. Do that for 5 or 10 minutes. And then keep focusing that each time you inhale, you focus on the weight going up. Even though you feel the discomfort in your stomach, and when you, or wherever you're feeling it, and then when you exhale, imagine almost like the air can go out. I would breathe through my nose, but I'm making the sound right now. And just imagine air can go out, almost washing through the abdomen, like maybe a blue color or something that feels soothing. And then imagine going right out your legs. And if you just did this right now, just put your hands on your stomach for a moment. And as you inhale, let your stomach get bigger. Notice that if you looked at my neck, it didn't really change. And now as you exhale, let's take your hand, stroke from your stomach downward, down your hips. I'm making the sound, down your legs, all the way to your feet. And then when you come back up, inhale again when you come up, feeling your stomach getting bigger. And the nice part is when you stroke slowly, it distracts your attention as well. So the key is you can feel the flow going right inside.
I love that because it gets people out of their head.
Correct. You can, and sitting, you can even do this right with your arms. For example, you let your stomach get bigger and then bring your right hand to your left shoulder and then stroke right down while you imagine like the arms are like straws and hollow. It goes right out of my fingers. And then it's easier because you have these sensations left over in the body to keep your attention. And then when the worry occurs, oh my God, whatever, what I'm going to do tomorrow. Yes. That's okay. It's real. Shh. Yeah. And because what we forget is that when we think about it, our bodies get activated, and that makes the symptoms over time worse, or let's say it inhibits the regeneration. And we want to give the support for the regeneration.
I love it. I love it. I think that's going to be so, so helpful. So helpful. In your research, do you see anything in terms of the timeline for how quickly that helps somebody? And if practice for a period of time, is this something that you see over time help, like the long term? Is it something that you have to practice every single day for 10 minutes? Sure.
It is not that you have to practice it every single day for 10 minutes. I'm purposely saying that. Yeah. Think of it a little bit as a skill learning. The most challenging part is, for most people, is one is just to learn the skill. Many of us, however, have overlearned the wrong skill of breathing. So we're breathing like this. And if you're a musician or a sports person and you have practiced the wrong maneuver all the time, it's almost harder to get rid of that. So you have to really overlearn. So one is mastering the skill. And that means also changing your clothing sometimes. That's very difficult because we deal with self-esteem issues. My God, if my stomach gets bigger, who will ever want to love me, right? Over those sense of attractiveness, very challenging. I realize that. But it's really a sense of trust. That's one. And then the second part is you practice, so you master it. And then you need to incorporate it into your daily life. So every time when you hold your breath, you catch that, and later on you anticipate and practice enough that it becomes the new automatic thing. Let me give an example how easily we hold our breath or whatever we may do. In a moment, I'm going to ask you to, when I make a sound like a clap, to just look to the extreme right and then next clap to the extreme left with your eyes. Okay. So if I did it, it would look just like this. If that makes sense. Really move. Are you ready? Yes, go. Are you holding your breath?
Yes. So quickly.
Yes, and what we don't realize is we gave a kind of alarm reaction, a startle response, an orienting response, as it may be called. This is biologically normal because imagine we were walking through the savannah or the jungle and I hear a noise in the periphery. It could be the saber-toothed tiger. I better be aware of the friend or foe and freeze. And I freeze at that first moment. And the reason I freeze is because then I'm less visible for a moment and my hearing becomes more acute as well. I still get all mobilized, so I can run away. And then if I run away, see, at that point, when I give this reaction, why should I digest my food? Or to think about it in a different way, at that moment, I need to remobilize myself to run away, fight, and flight. Because why should I restore myself? Why should I regenerate when I become someone else's lunch?
Yes.
It's a strange, but it's a very simplistic model. But notice how we all held our breath when we just did this. When you're working at the computer, that's the whole part of our book, in a sense, looking at these evolutionary patterns. These are now become traps that we react to much, just like that we look, we forget, we collapse, and these all amplified. And yet there's so many things we can do to not do that. So to answer your question, finally, you're asking, how long will it take? It varies. The first case I gave as an example, was this young woman. She did it within a week. And here she has 6 or 8 years of horrible history.
Yeah.
She has never had it since.
Wow.
But what made her different, she did it all the time, or most of the time. The moment she became aware, she would interrupt. The similar thing we have seen with women or the people who have had acid reflux. You could think of acid reflux in a simplistic way, is that the abdomen squeezes too much, that pushes the stomach content upward.
Yeah.
And if you can reduce that, then you have less problems.
Yeah.
And what we found is when the person really breathed lower and allowed that, the symptoms decreased quite radically. However, and that is what we forget, you have to do it during the day when you're driving.
Yeah.
So when driving, you want to put a pillow, like you said already, behind your back so you're not scrunching forward.
Yep.
Sitting at the computer, you may need different glasses so you can see the screen better, or a bigger screen. If you're using a laptop where you're looking down like this, wait a minute, maybe I need an external keyboard so I can look at the laptop.
Same.
And then I need to identify the beginning of the cue, of the symptom, not when it's all achy, almost when I just held my breath. At that moment, I go back, and we can role rehearse that. So you start practicing that. Every time you pick up an object, you're starting to exhale already. It makes a difference how you do it.
Yeah.
Then we find that it's remarkable. I mean, I am so impressed about that, the possibility. Yeah. Because when we breathe this slower way, we let our shoulders go back and down, we improve. And that reminds me, because even for me, here I teach this.
Yes.
And when I'm working at the computer, for example, I totally forget that I'm slouching when I'm looking at you at the screen or whatever. I really don't remember. So what I now do, we use that's our research. We have used biofeedback devices, which are, and they're used to be very sophisticated and laboratory times. Now we use a little device called an upright, which you may know. You put it on your spine, and then after you adjust it on your cell phone, tell yourself what is tall. The moment you start slouching, it vibrates. Right. And you can adjust it. You know, it isn't that you should always just sit up again. But the key is it teaches you the awareness. And for some of the people we worked with, and our students and employees, what they observed was the following 3 things. 1, they start to slouch, obviously for the ergonomics. I'm looking at the screen better. 2, I start to have negative depressive thoughts. 3, I'm tired. 4, if you're a woman, because the men did it less, when they cross their legs, they automatically scrunch their body.
Yep.
And there were other reasons as well. And then whenever this alarm went off, they would then, doesn't always mean they sat up straight. Sometimes it meant I need to just interrupt. I need to do some movement or exercise. And just as you're listening right now, just get up for a moment. Just explore it. Just imagine, just told you. Now just get up. And now for a moment, just reach way to the ceiling with one arm and then the other. Really with one arm and the other. Keep doing, you can even half dance, and you can even swing around. You can even interlace both hands like this, and then just make big circles around yourself. And then the other way. And remember, keep breathing. Because we so often forget. And then roll your shoulders or so. And now just sit down again. And just even ask yourself, wait, at this little interrupt, do you feel slightly more alert? Slightly better? Were you slightly distracted from the sensations in your abdomen?
Yeah, it's the blood flow and the connection. You start to feel that immediately when you start to get that circulation kicked up. Yep.
And so many people forget when they have abdominal pain, they tighten their legs, they tighten their hips, and they tighten their neck and shoulders. And so really.
And so all of this can get tight because you're leaning forward, causing all of this neck and tension pain.
Yes.
Yes. And then you've got this whole feedback that happens with that. Yep.
And if you just think about it, then I'm totally erect. The muscles in my neck and shoulders, or the muscles in my neck that hold up my head, it's an equivalent maybe of 10 pounds they have to work with.
Yeah.
The moment my head goes forward like this, the cell phone look, the hopeless look, the television look sometimes, this is an equivalent force of 60 pounds.
Oh,
so my back had the muscle, because now I'm over the center of gravity, it has this weight that is equal to 60 pounds. But these muscles have to really tighten. And what people forget, and that includes in your abdomen or any of your muscles, muscles work best when they can tighten and relax.
Right.
Tighten, relax. And what so often happens when we become fearful or we have pain, I don't want to make those together, then we freeze. We freeze in place in anticipation, both in pain and in anticipation of pain or discomfort. And that freezing now makes the symptoms worse over time. Right. Because what we forget is that our imagery, our thoughts, the images we have create almost in our body those muscle patterns. And I can explain, let me do that by an example, if that's possible, how important the images we think of our bodies have. Just imagine for a moment, and don't do this while you're driving at this moment, okay? That just imagine, close your eyes, just wiggle around for a moment, take a breath, put your right hand on your left shoulder, inhale, and as you exhale, stroke down your arm. Inhale, put your left hand on your right shoulder, and as you exhale, be aware of the sensations in your arms and just imagine the air flowing down your arms with each breath. Let's do 1 or 2 breath cycles that way. So when you're exhaling, think of the air flowing down your arms. And now I'd like you to imagine a very big yellow lemon. You know the one with the 2 chubby ends on it? Really nice yellow lemon. And once you have imagine this big yellow lemon, what I'd like you to do is get your cutting board in your kitchen, put the lemon on the cutting board, then get a knife, hold the knife in your dominant hand, and now cut the lemon in half. And as you're doing that, you can feel the droplets of lemon juice sprinkling against your skin. You can feel the tension in your arm as you're cutting through the lemon. After you have cut the lemon in half, put the knife to the side, pick up one of the half lemons and look at that. Notice the outer yellow rind, the pale whitish inner rind, the half-cut pits, the droplets of lemon juice almost glittering in the light. Then get a glass, and now with the half lemon in your hand, bring it over the glass, and now squeeze that lemon so that the juice goes into the glass. And as you're squeezing that, you can almost hear the hearing of the droplets and pits dropping down. Squeeze it more, feel the droplets of lemon juice against your skin. Feel the tightness in your forearm. You may even have been holding your breath. After you have squeezed this 1/2 lemon, put it down. Pick up the other half lemon. Really squeeze it, keep breathing. Squeeze it and squeeze it and squeeze it so the juice goes into the glass. After you have squeezed that, put the half lemon down. Now take the glass, gently lift it to your lips. Feel the rim of the glass against your lower lips. Feel the coolness of it. Now tilt the glass, feel the lemon juice against your lips. Now open your mouth, tilt the glass more, and now just swallow the lemon juice. Right. And you can spit out the pits if you like. Good enough. And now I could ask the question, how many of you got an increase in salivation?
The second you said lemon.
Yes.
Very start.
And how many, you almost get this feeling. Yeah. But notice the image of the lemon caused salivation, which is an autonomic response. Once one gets that concept, it's critical to realize the images we create in our brain have a direct effect upon our physiology. They're not separate.
Right.
And what is often the imagery we have when we wake up in the morning, even if we don't have pain? I'm going to have difficulty going to the bathroom. We're already putting in those negative images. It is not negating at all to be objective and say, I have this, but at least shift the images to positive images, to evoke those. And they will help nurture, because healing occurs when we feel safe. And however safety is defined, create safety for yourself.
Love that. I think that's a really good note to end on too. Erik, thank you so much. That was
my pleasure.
Conversation.
I would say, I mean, honestly, I think many of these practices are in the book as well. And I highly recommend it for people, that they would get that both to be, I mean, they can almost do all the things in the book, and it would improve their health for them.
Of course. And that's tech stress, how technology is hijacking our lives, strategies for coping, and pragmatic ergonomics, which is so appropriate, again, if you're dealing with a chronic health issue, a chronic gut issue, and you're trying to do all your research, and you're online a lot, and you're staring at your phone a lot, and you're up at night not sleeping, looking at your phone. All from that perspective, tech is really affecting us and our health. And I think so much of what you're saying is just spot on. I think it's going to help a lot of people.
And if people would like to know more, I have a blog which is called pepperperspective.com.
Perfect.
And it's Pepper with one P, P-E-P-E-R, perspective.com. And in the little box, you can type in IBS or irritable bowel or whatever. There are many different topics, and they're usually research-based with lots of references.
I love it. I'll link everybody to it. Perfect. Thank you so much.
Well, thank you. It was a pleasure meeting you.
You too.
Truly.